Welcome back. Good to see you again, Richard.
Good morning.
Good
Still
morning. So here we are. We're going to talk about, we're going to continue our conversation from last week about attention deficit hyperactivity disorder.
Right.
Last week, we talked about some of the symptoms and the prevalence of ADHD. And this week, we're going to talk a little bit about the diagnosis and treatment of
Right.
ADHD.
Right. Yeah, when it comes to diet, there's so much controversy with this. And again, as we're looking through all the materials on this, there are just thousands and thousands and thousands of articles on ADHD. And you think the last word certainly had to be said on this topic, but we find that it hasn't been said.
Right.
And what we mentioned last week was that we often forget that there's a new generation of parents coming, and they really don't know anything about ADHD unless they either had it themselves or they had a family member. And so what we wanted to do is to provide this update for those parents and families who are just discovering this disorder for the first time.
Right.
So we want to sort of do an update, talk about diagnosis and treatment.
Yeah, absolutely. And I think as we talk about diagnosis and we talk about, what we go through when we're looking at symptoms to lead to a diagnosis, we want to begin by saying that just because you have symptoms doesn't mean you have a diagnosis.
I wish we could say that about 5 times. You have to remember that just because you have the symptoms, you don't necessarily have a diagnosis. And one of the things that you and I tear our hair out about is people going on to Google, especially, children and teenagers. They go to Google and they see symptoms and say, oh, I must have that. Okay. No, we all have symptoms of ADHD at one time or another. It doesn't mean we have the diagnosis.
Absolutely. And, one of the things that I have found myself saying to a lot of, especially kids and teenagers, as you said, is, but also adults, is that just because you're bored or just because you're disinterested in something doesn't mean that you have ADHD. Any of us can sit in a classroom or in a meeting, and if we're not interested in what's being said, or if there's, lots of other things on our mind, or lots of other things happening in our lives, we can very easily be taken off task, or we can very easily find ourselves distracted by other thoughts or other things that we have to do. That's not ADHD, not necessarily.
That's right. Yep. Yeah, the primary symptoms of ADHD are poor impulse control, inattention, the inability to focus and attend, being bored easily, maybe being overactive. So those are the 3 primary symptoms, but all of us can experience those things at one time or another. And those same things can be caused by ADHD or by depression or by anxiety or by just having family problems, marital problems, or doing poorly in school, having learning problems, or surviving trauma. Right. Any of those things can cause or be associated with the exact same characteristics that we see in children with ADHD. So we need to be very careful.
Absolutely. So ADHD is a neurodevelopmental disorder. And so that means that there are differences in the brains of people with ADHD versus people who don't have ADHD. Now, that's not diagnostic, meaning that you can't go and get the fancy machines and take a picture of a person's brain and be able to say, oh, that person has ADHD. It doesn't work like that. It's more, if you take a whole bunch of people with ADHD and look at their brains and compare their average brain to the average brain of people without ADHD, there are differences.
Right.
That's very different. We know that there's something in the brain that's different for people with ADHD, but you just can't use that as a measurement for determining whether a person has it or not.
Yeah. And when we talk about making a diagnosis or confirming that it is ADHD, many people still don't believe that ADHD really exists. All right. True ADHD is a neurodevelopmental disorder. That means that there is something different in the brains of individuals who have ADHD. it's not made up. It's not recent. It's not because of video games. There are brain differences in people who have this disorder, and it impairs them. The other problem is that the neurodevelopmental differences create some impairment in these people. So not only do we need to rule in that there is impairment, so that's the first job. You have to say, okay, there is impairment. But the second thing you have to do is make sure that whatever symptoms there are not caused by something other than ADHD. So it's a two-part process.
Right. When as we do evaluations for ADHD, one of the things that we do is we may put a person through a series of tasks to look at their ability to focus and to, organize their thoughts and those kinds of things. And even with the direct testing that we can do, I think it's important that people recognize that all the testing tells us is, yes, the person has difficulty focusing.
Right.
It still doesn't tell us if it's because of ADHD or if it's because of anxiety. And so, Richard, how many reports have we read from other practitioners who may do hours worth of testing on a kid, and it comes back with they meet diagnostic criteria for ADHD and depression and anxiety, and they need treatment. Well, we probably knew all of that to begin with, because all you're doing is saying that they have inattention and some of these behaviors, and it could be because of any of these reasons.
That's right. And so what we do when we meet with the child, when we meet with the parents, all we want to be able to do is to say, I observed inattention. I observed poor impulse control.
Right.
I observed hyperactivity. We made those observations. So we put the child through certain tests. We don't find ADHD.
Right.
We confirm that the child has this, and then we meet with the parents and other people who know the child and say, and it's not because the child is depressed or anxious or traumatized. Okay. So we also have to take a very careful clinical history to say it's not these things. We did make the observations. It's not these things, and the child is really struggling. Okay.
Right.
Then we can move toward a diagnosis. There's no test for ADHD.
Right.
There's no neuroimaging, PET scan, MRI, CT. There is no test for ADHD. There's no paper and pencil task for ADHD.
Right.
All these tasks that we do are designed to, did I observe those symptoms?
Right.
And is it because of ADHD?
Right. And I think that you used just the right word that we want to emphasize, and that is clinical. Right. ADHD, just like depression and anxiety and schizophrenia and bipolar disorder and all of these other conditions, these are all what you call clinical diagnoses. And that means there's not any test, there's not blood work or anything like that you can do to assess any of these mental health conditions. They're all clinical diagnoses. Right. And now that is what introduces so much controversy as it relates to them, because, at some level, I suppose, there is some subjectivity to some of these diagnoses. We've talked on many podcasts before about how a kid with ADHD may demonstrate some of the exact same behaviors as a kid who's diagnosed with oppositional defiant disorder. Mm-hmm. The behaviors are exactly the same, but the people who report on it, or the psychologists or therapists doing the observations, attribute the behavior to either inattention and difficulty focusing, ADHD, or as intentional willful behaviors, oppositional defiant disorder. Yeah. It doesn't necessarily mean that there's anything different about the kid or how the kid's behaving. It just means that the people who are talking about it talk about it differently.
Exactly.
And so that's where the clinical piece comes in so important.
Right. Yeah, you observe the same things.
Yeah.
And so when we talk to parents, especially new parents, and we talk about what is impaired, we say, when we talk about impairment, you can think of impairment in 5 categories. Right. You can talk about impaired behavior. Yeah. They don't have impulse control. They don't self-regulate. They have higher activity level. They talk too much. Or their thinking, their cognition, they don't have adequate attention or memory get affected. Or it can impair them in academic areas, especially reading and math. Socially, they have more problems than other kids. They they don't interact successfully with adults and peers. Typically, what you hear about kids with ADHD is they're a nuisance.
Right.
They're not destructive or dangerous. They're just a nuisance. They're always talking, they're always moving, they're bugging other kids, they're interrupting, they're
Well,
distracting themselves and others. And then also you have emotional difficulties.
right.
Remember, these kids, they suffer from recurring punishments because they are misbehaving, they are too active, they are too impulsive, they're always being corrected, they're always being yelled at. And so it begins to damage their self-esteem and their self-confidence. Okay.
Yeah.
So if you're a parent of a child, think about behavior, cognition, academics, their social development, and their emotional development. And we try to figure out, where is the impairment? Which area is the impairment?
Right. And one thing I would add on the social piece is that, yeah, they're often seen as, many times they may be seen as a nuisance or as maybe annoying or just
Right.
irritating. But at the same
Mhm.
time, they're often seen as a lot of fun. When you're out on
They
the
are. They
playground,
are
or when
fun.
you're doing something like that, there's a lot of fun there, because
Right.
they're just they may constantly be going and wanting to play and just, they want to have a good time. They're because they're constantly seeking that stimulation for
They
having
seek
fun.
stimulation.
Right.
It's funny when it comes to they're always seeking stimulation, but they're overwhelmed by stimulation at the same time. Okay, so it's always a two-edged sword with these kids.
Absolutely.
Yep.
So again, as we think about the diagnosis, we talked last week about how there are, there are 9 diagnostic symptoms that we look at for inattention. There are 9 that we look at for hyperactive impulsive, and we go through them. There are these 18 symptoms altogether,
Right. Mm-hmm.
and those 18 symptoms may be present in one person and look one way. They could be present in another person and look completely different.
Right.
And so even though you have these common symptoms that we use for the diagnosis, the way in which they manifest can vary greatly from one person to another. And again, this is where that clinical piece comes in, where the person that's doing the diagnosis, you want that person to have a lot of experience working with kids, typically developing kids, neurodivergent kids, behaviorally challenged kids. You want a person who's doing the evaluation to have lots of experience across the spectrum of working with kids, so that they can say, well, this is typical behavior. This is just the way that kids that age behave, or that behavior is quite expected given this circumstance in his life,
Right.
or this behavior is not typical and is indicative of an attention deficit hyperactivity disorder. So you want somebody with that kind of experience, because at some stage, every kid manifests all of these symptoms, and it's quite typical for them to do so.
That's right.
You have to figure out when it becomes a functional impairment and when it's, developmentally inappropriate.
Right. That's right. So it requires that knowledgeable assessment.
Right.
That it's not just, do I have symptoms? It's a 3-part assessment that has to be done very carefully by somebody who really knows child development and somebody and adult development. Okay.
Right.
So we're not just talking about children, we're talking about children and adults. And we're also searching for impairment. Just because you have the symptoms doesn't mean you have the diagnosis. And we have to keep stressing that.
Right. Absolutely. So
once we make the diagnosis, we move on to treatments. Treatments fall into 3 broad categories.
Right.
So if you're just entering this area, one is medications. You have to talk about medications. You have to talk about all of the behavior management things that you can do. And then there's an increasing area, and you can see it when you go on the internet, of what we call alternative treatments.
Right.
So treatment is in medications, behavior therapy, and alternatives. And we want to talk about each one. When we start talking about treatment, we have to begin by saying at age 6, because the American Academy of Pediatrics and the American Psychological Association both encourage that if a child is younger than 6, that you begin with behavior management.
Right.
If a child is older than 6, you begin with medication and behavior management. So 6 seems to be the cutoff. So with that in mind, we want to first talk about medications.
Right. And when as we talk about medications and talk about treatments in general, notice, like what you just said, that it's rarely, if ever, that someone would recommend medication alone.
Right.
Remember that medication, the way that we talk about medication and the way that we'd like for people to think about medication is medication makes the child's brain available to learn, makes the child's brain available to focus, to attend, and to gain the skills and build the skills that he or she needs. It doesn't teach skills itself. So if a kid has ADHD, and one of the characteristics of ADHD is difficulty organizing and planning and anticipating, and those kinds of things, taking medication doesn't make a child more organized.
Right.
But it makes the child's brain more available to learn how to become organized. And that's where the behavior management strategies come in. And so we'll talk about that in just a minute. But with medications, we're talking about 3 broad classes. There are the stimulants, there are the non-stimulants, and then there's medications that are used off-label for treating ADHD. The most common medications are the stimulant medications. And for the vast majority of kids with ADHD, or even adults with ADHD, the stimulant medications are very effective.
About 80%. Yeah. But remember that there are going to be a number of children who don't respond to medication. They don't affect all children, but they are effective in about 75 or 80% of cases. Okay.
Right. And so with the stimulants, you have 2 kinds. You have the methylphenidate based, and so those are the like Ritalin and Concerta and those kinds of medications. And then you have the amphetamine based, which is like Adderall and Vyvanse and so on. So for a variety of reasons, and they tend to be neurobiological reasons, methylphenidate works really well with some kids, and amphetamines work really well with other kids.
Right.
Sometimes a physician will try Ritalin with one patient and it doesn't go so well. They change to Adderall, and there's the change that you were looking for. There's some new testing that can be done that can help anticipate which one would be better for a child. But again, sometimes one medication works better than another medication. And sometimes even within the single class, sometimes Ritalin doesn't work as well as Concerta for some reason, even though they're both methylphenidate. So sometimes you just have to, there is some experimentation that has to be done to figure out which one is best.
Right. Yeah. What these medications do is they just increase the amount of certain types of neurotransmitters, certain brain chemicals. Okay. And we don't know enough about that. Nobody knows enough about this to know exactly how these things work. It's a complex process. We really don't understand it. What we do know is that since 1938, individuals who have ADHD respond positively to these medications. When I say respond, it reduces symptoms. Right. And doesn't cure anything, but it reduces symptoms. And as you said, it makes the child available for teachers and parents. Okay, then what teachers teach and parents manage behavior, it makes their job a little bit easier because you reduce the symptoms.
Yeah.
But it is a trial and error. You're going to try different medications until you find one that works. Not every medication works with every child.
Right.
And you can have some children respond well to methylphenidate, then they quit working and you have to switch to amphetamines. We don't know why, but we can judge the response. So when you talk about medications, we're talking about the stimulants, but now there's a group of non-stimulant medications that have come out. Okay. Right. Parents who don't like to put their kids on stimulants do have a choice, and they can use what are called non-stimulant medications.
Right. And the non-stimulants, my experience is that those medications tend to be best used in the kids who also have maybe co-occurring anxiety or some high levels of stress. Right. because in those kids, the stimulant medications may make some of that anxiety and stress a little bit worse. And so then they go to the non-stimulants, and there's a variety of non-stimulants now. Strattera is one. The generic is atomoxetine, but it works on serotonin and norepinephrine. Serotonin, again, because of some of that, it helps with some of that anxiety. Guanfacine is one that's been around for a long time. Clonidine has been around for a long time. Those are actually old school blood pressure medications that seem to work very well on the sympathetic nervous system and helps kids with ADHD, some kids with ADHD. So there's a variety of non-stimulants that some people have found to be effective in managing some of those symptoms.
Yeah, the most recent entrance is a medication called Qelbree, which has appeared just recently. We don't know a lot about it, but some physicians are beginning to use that as well. Yeah. So there are some non-stimulant alternatives. Frequently, if you have children who are very, very thin, and because we know that stimulants are an appetite suppressant, so you don't want to suppress the appetite in a kid who's already very thin. So physicians might move to the non-stimulants, but it does give you an option. Right. And then there's a third category of drugs, we say off-label. These are drugs created for one condition that may help another condition. So for example, certain antidepressants might be helpful for some children with ADHD. Okay, Wellbutrin, for example, has been tried with older children, adolescents, and adults.
Yeah, and even some mood stabilizing and medications like Abilify have been used for kids with ADHD. And again, those tend to be used in kids with ADHD with co-occurring conditions, depression, or sometimes kids with anger-related problems, or they have such significant impulse control problems that they act out and they become really aggressive and things like that. Sometimes, like Abilify and those kind of medications are used to help mediate some of that.
Right, but this is where you need that very careful, knowledgeable differential diagnosis, because if the clinician sees more anxiety, then that's going to move you maybe in a different direction with medication, because that a stimulant might make the anxiety worse. But you have to see the anxiety. You have to be aware that anxiety could complicate the medication question. So it's not just, again, we have to keep repeating that. It's not just having the symptoms. Right. You have to know all these other things.
Right. Now, when you think about how the medications work, it is a complicated and somewhat, we don't really necessarily completely know why some of the medications work at times. We know that some of the areas of the brain that control things like inhibition and our ability to focus and those kind of things typically run off of neurotransmitters like dopamine and norepinephrine. And so taking medications like stimulant medications to increase those neurotransmitters in those regions of the brain, they help. It doesn't, like you said, it doesn't cure anything. It doesn't make the brain say, oh, well, maybe I should start making some more of these neurotransmitters. It doesn't do that. It just provides more of those neurotransmitters so that the brain can function in the way that it needs to function. Right. And as we've stressed, all it does really is reduce symptoms for a period of time. While the medications are effective, it reduces symptoms so that the child is more available to learn and to access information that they've stored in their brain. But that's about it. That's about what the medication does.
Right. That's right. It's just going to reduce symptoms so that you can move on to the second type of intervention, which are all the behavior therapies. And every study that's ever been done for the past 50 or 60 years says a combination of medication and behavior management is the best way to deal with ADHD. When we talk about behavior management, we're talking about behavioral interventions that you can use with the child directly, or you can train teachers to use, or you can train parents to use. Right. And of all the people involved here, I think parents are probably the key, the key people to manage children with ADHD. They spend the most time with the child, and they have the most knowledge about the child.
Okay? Well, and let's be honest, if the kid's on medication, the teacher tends to have the child while they're on medication.
Right.
But by the time the parent has the child that evening, the child's not on medication anymore. The medication wears off. And so, the parent it's really critical that the parent has some of these strategies. And it's important to say that we said it last week, but just to repeat, a kid with ADHD is a kid with ADHD. It doesn't come
every day, every outing, every grade, every activity. If you have ADHD, it's always present. It doesn't just happen in church. It doesn't just happen in math class.
And it doesn't just happen because they ate some sugar. It's there all the time. And so that is important for the parent to know, not just because the teacher and everybody else to know, not just because from a diagnostic perspective.
Right.
It's important to know because we tend to work from the perspective that kids want to behave. Kids want to do well. They want to meet our expectations. They want to make us happy. They want to, they don't want to get in trouble. So when a kid does things repeatedly, and kids with ADHD will do things repeatedly that get them in trouble, they're not doing it intentionally. They're not doing it because they don't know right from wrong. They're not doing it because they want to upset you. They're doing it because they have ADHD. The very nature of impulsivity means that you're behaving without thinking about the consequences. Right. So when your kid does something and you say, "What were you thinking?" The answer is that they probably weren't. They weren't thinking about the consequences before they did it, or else they wouldn't have done it. So punishment isn't the best strategy to use, because if punishment worked, then they wouldn't be still doing it. What we need is more patience, to take more time, and yes, repeating the same thing over and over and over again. Just be prepared for that. You're just going to have to do that.
That's right. If you have a child with ADHD, that child is going to require more time, more patience, more attention than the other children you have. It's just, and you are going to say the same things over and over and over and over. And it's not because the child is being willfully disobedient. It's because they have ADHD, plain and simple. So the goals of, if you're a parent, or if you're a partner of somebody with ADHD, you have sort of five simple things you need to do. Number one is prevention. If you have a child that comes unraveled at Walmart, then don't take the child to Walmart. So prevent, maintain routines, help the child with school, because they're not going to be able to keep that stuff organized. Keep things positive. Don't move toward punishment, because it's not going to work. So keep everything positive. And please understand, there's not going to be a quick fix. No matter what the advertisements promise, there is no quick fix. This is a lifelong endeavor, and there isn't a quick answer to it. It's going to require a great deal of work and a great deal of thought and a great deal of planning to do this.
Absolutely. Now, so we've talked about medications, we've talked about behavior management, and just to spend a moment on the alternative treatments, there are lots of things out there on the internet, from supplements like omega-3 and magnesium and zinc and some of those kinds of things, to neurofeedback. There's an app for your phone that reportedly will help with focus and attention. People talk about the use of music and exercise and some of these other things to help with ADHD. And yes, for some kids, many of these things can be very effective. It isn't at the level where, as with medication, 75 or 80% of kids with ADHD improve with these things. If they were, they would be great. Put a kid on a good exercise regimen and it cures ADHD. That would be amazing. But it's not as predictable, and it's not as consistent of findings as we see with medication and some of the other things. So, so there are lots of other things that a parent can do for their kid with ADHD. And there's going to be a link in the show notes to a site where you can go and read a little bit more about treating ADHD without medication. But just remember that while there are some anecdotal reports about the benefits of some of these things, the results just aren't as consistent as we see with the other treatments.
Right. And when you enter the world of, if you're going to enter the world of alternative treatments, particularly with children, um, be very, very, very cautious, because people say, well, I don't want to put my kid on drugs, so I'm going to put my kid on omega-3. Well, when you put stuff in your body and it goes to your brain, it really doesn't matter whether it doesn't matter. I mean, you're putting stuff in your body and it's going to go to your brain. So parents say, well, I don't want to use drugs. I'm going to use focus factor. Well, I'm sorry, focus factor is designed to do the same thing that drugs do. Okay.
Because if it helps with the symptoms are brain based. So doing something to the brain.
Right. You're still affecting dopamine and norepinephrine. That's what you're trying to do.
Right.
Okay. So don't say, well, I'm not going to do it because supplements are not dangerous. If you're two things, whenever you go to Google and you see AD besides on the upper left, that's an advertisement. Okay. So be very careful when you're reading advertisements. All right. Because they're going to make everything sound effective. If you're going to move to alternatives, be sure to check with your pediatrician, because they have to know that you're doing this. All right. Because there are interactions that you can get into. So no matter what you do, make sure the pediatrician knows what you're doing. And be very, very careful when there's a thing called Prolia, Synaptal, Focus Factor, Chillax. There are hundreds. Go on to Amazon. There are hundreds of products available to treat ADHD, and they all have testimonials, and they all sound like they're effective. But please be very, very careful. Right. There are some computer-based programs. Neurofeedback, Play Attention is another one. A lot of brain training programs. We don't know how well they work yet. We just don't have enough research to say, yes, this works. Okay. So be careful. Same with diets. You can add stuff to your diet, or you can eliminate stuff from your diet. If it works, probably no harm done. It doesn't hurt a kid to have a little more protein. Right. It doesn't hurt a kid to reduce fats or to reduce sugar. There's a lot of benefits to reducing sugar. But if you have a child with ADHD, remember sleep, exercise, and nutrition. No matter what else you do, you should be working on those three things, because those will assist. Those could make ADHD worse, and they could help you manage ADHD if they're going well.
Right. Yeah. And we could do a whole other podcast on some of those things, because, many times parents will look for treatment to enhance performance rather than treat impairments. A kid is sleep deprived because they're not sleeping very well, and so they start falling asleep in class, and then people start saying, oh, well, maybe he has ADHD, the inattentive type, and that's why he keeps not paying attention and focusing in class. Well, it could be because he's getting 3 hours of sleep a night.
Right.
Right. So we have to be careful that we're not providing treatment, especially medication, to try to enhance performance, help a kid do better. My kid makes B's, but I really think he can make A's. And so if he's on medication, he can focus a little bit better and get more work done. That's not a proper use of the medication, for one. And for two, it's not going to really be effective that way. So we have to be mindful of that.
If we have a minute, one of the things we worry about, parents always ask, well, what is the risk for addiction? Well, if you use these medications to enhance performance, and you frequently hear kids say, well, if I have to study for a test, I'll take Adderall. If I have to do a paper, I'll take Adderall. Mm-hmm. That's the slippery slope toward addiction. All right. Because you're not treating impairment. Right. You're looking for performance enhancement. And there's an enormous difference between the two. Right. These medications were not meant to be used to get A's instead of B's, or to be able to do homework, or to be able to do anything. They were meant to treat real impairment. Right. And if you're using it for that, the risk for addiction is very low. If you're using it for performance enhancement, the risk for addiction goes up. So be very, very, very careful about that.
Absolutely. Absolutely. So, all right. Well, there are links to several articles in the show notes so that you can read a little bit more about some of the things that we've talked about today. I think we could just say safely that there's never going to be enough said about ADHD. It's just going to keep coming up, and we're going to have to keep talking about it. And so if you have questions or you just want to know more about some of this, let us know, and we are always happy to share more about what's going on with ADHD and treatment and everything else. So, all right. Well, that's it for this week. Until next time, stay happy, stay healthy, and forget to be afraid.